Welcome everybody to my live. So in this live, I would like to discuss urticaria as well as angioedema. Okay, mainly the presentation and management. So urticaria is a common allergic disease. Okay, so um, just see quickly. Okay, so urticaria and angioedema. So urticaria is a transient vascular reaction in the skin, and it is considered a clinical sign, not a single disease. And it manifests as wheals, also called hives. Okay, so in terms of the presentation, so it manifests as wheals or hives. Wheels are multiple branching papules with a central area of edema surrounded by a flare comprising reflex erythema. So the size of the wheels, so maybe I'm just gonna put something like that. So there's multiple papules with edema in the middle, and the size of the wheels may vary from 2 to 3 millimeters to greater than 10 centimeters. The wheels are intensely itchy, so itchiness is definitely another presentation as well. And then it comes and goes, lasts less than 24 hours, and resolves without any skin discoloration or scaling. Now, angioedema is a transient swelling in the deeper tissues of the skin or mucosal membranes. Okay, so just maybe do this and this. Okay, so the presentation of edema. So it's asymmetrical, non-pitting, and it's not associated with erythema. Okay, so it's a brief swelling, uh, deep tissue plus skin and mucosal membranes. Uh, Clinical feature: it is asymmetrical. It is non-pitting, and it's not associated with erythema, so it's not red. It tends to be painful rather than itchy, so it's not itchy. It's rather quite painful. Okay, and make up take up to 72 hours to resolve. So the urticaria lasts less than 24 hours, and the angioedema takes up to 72 hours to resolve. So I would say less than 72 hours. Okay, commonly affects the lips, hands, feet, genitalia, and the tongue. It may be life-threatening if it does affect the larynx. So the following patterns are seen: urticaria alone 50%, urticaria with angioedema 40%, and angioedema alone 10%. So urticaria usually goes with angioedema. When angioedema is present with urticaria, the causes and pathophysiology are usually the same as with urticaria occurring alone. But angioedema is an indicator that the urticaria is more severe and will be more difficult to treat. Okay. Angioedema occurring alone has a different pathophysiology, set of cause, investigation, management to angioedema occurring with urticaria. When angioedema occurs alone without urticaria, causes include induced angioedema and hereditary angioedema type 1 2 and HAE with normal C1 inhibitor. These do not respond to antihistamines and may cause upper airway obstruction. Idiopathic non-histaminic angioedema also occurs. So wheals occur with or without angioedema. Atypical features: longer duration, lack of response to antihistamines may indicate an autoinflammatory disease or vasculitis. Where these features are not present, As such, physical triggers may reveal an inducible urticaria, whereas spontaneous symptoms may indicate chronic spontaneous urticaria. The presence of isolated angioedema should trigger search for medication-induced angioedema and for hereditary angioedema. So we're going to look at greater detail at it next. So basically, the patient has wheals. So if the patient has wheals or hives, basically patient has urticaria, easy recurrent or unexplained fever, any joint or bone pain or malaise. If yes, it's an autoinflammatory disease expected and could be acquired or hereditary AID. Um, if there is no autoinflammatory disease expected, then it's the average, and we should ask whether the average will is duration of more than 24 hours. If it was more than 24 hours and there is signs of vasculitis in biopsy, it's an urticarial vasculitis. If it's not, if the average will was less than 24 hours, then we go to um, then we basically then it could be HIE 1 or 3. If the symptoms are induced, okay, if there's no signs of vasculitis on biopsy, then we ask them all symptoms inducible. If it is inducible, we do a skin test and it could be chronic inducible urticaria. If it's and then the skin test is negative, then it's chronic spontaneous urticaria. For angioedema, we ask them if there are any if there's any ACE inhibitor treatment. If there are, we ask them if the remission was the remission of the stop. If yes, then it could be ACE induced, right? Angioedema. ACE inhibitor induced angioedema. If the remission did not stop after, if there was no remission of the angioedema after the ACE inhibitor was stopped, then we ask them, then the HIE or AAE is expected, and then yeah, okay. So those are all the causes, and then causes we have interleukin 1, histamine, other mediators of mast cell as well as bradykinin, and all of those causing um, increase in vascular permeability, increase in the causing the swelling. Okay, now the classification and causes. So mast cells are the main cells in the pathophysiology of urticaria and angioedema. When these cells are triggered, they release the contents including histamine, tryptase, and platelet activation factors. This results in capillary and venous vasodilation, plasma extravasation, and cell recruitment leading to intradermal edema. Mast cells can release the contents in response to multiple factors. The action mechanism that the trigger uses to activate mast cells can be through IgE receptors and through other allergic and non-allergic pathways. So you have your activation trigger over there, mast cell releasing all those chemokines. Okay. So urticaria can result from activation of mast cells through IgE receptors, complement pathway receptors, or hormone receptors, as well as G protein receptors. And the mechanism, obviously, which physical and chemical triggers cause inducible urticaria are poorly understood. Okay, other causes include ingestion of exogenous histamine and other vasoactive compounds. So you have your mechanism, this activation through receptors, IgE, all those receptors, and the ligands, and examples are like cow's milk allergy, reactions to legumes, autoimmune urticaria, inflammation, stress response, and direct activation via cold heat, UV radiation, or water, sweat irritants, or pseudoallergens can cause inducible urticaria. So clinicians often divide according to the time course of the rash. So acute urticaria is essentially when the hives are present for less than 6 weeks, and chronic urticaria is when it's present for longer than 6 weeks. I think I'm gonna make a note of that as well. So and then episodic is intermittently but recurrently over months to years. Okay, so the hives can be classified either as acute. So acute is less than 6 weeks. Chronic is more than 6 weeks, and we also get episodic. Okay. Um, then for chronic, you get chronic spontaneous when there's no obvious trigger present, and chronic inducible urticaria is when there's a specific physical trigger that is responsible for that. Acute spontaneous urticaria Essentially, in children, the most frequent cause of acute spontaneous urticaria are viral infections, including upper respiratory tract infections, GI or UTI infections, Sequard, adenovirus, enterovirus, rotavirus, RSV, CMV, and Epstein-Barr virus. Drug hypersensitivity is another important cause of acute urticaria in children. Okay, in terms of the chronic spontaneous. So the chronic spontaneous. Okay, so what puts children at risk of an acute urticaria? So I'm just gonna maybe make a note of that. So what puts children at risk of acute urticaria? So the cause of it is viral infection. So viral infections as well as drug hypersensitivity. Okay, antibiotics or NSAIDs. Right? So viral infections, antibiotics, or NSAIDs specifically in children. And then chronic spontaneous, chronic spontaneous decay is often associated with angioedema and may be more difficult to treat. Okay, so this is usually with angio. Okay, with angio. I'm gonna stop over there and continue in another live with urticaria and angioedema.